Donc, bonjour, bienvenue à tous et à toutes. Good morning, everyone. We start any significant event at CHEO, and boy, is this a significant event at CHEO, with a land acknowledgement, of course, to recognize that we are here in the unceded territory of the Algonquin Anishinaabe people, and we honor their past, present, and future stewardship of this land, just as we honor all Inuit, Métis, and First Nations people. So this is an important day for us here at CHEO, and more importantly, for the kids and families that depend on care here. You will all know that the pandemic has had an outsized impact on kids. Kids really, in many ways, are the unsung heroes of this pandemic. They have given up enormous amounts over the past 20 years. It feels like 20 years, over the past 20 months. Here at CHEO, we are seeing the impacts of the pandemic on kids. We are seeing it in terms of learning loss, impacts on development, and physical and mental health. And that's what this announcement is about. I will stop there because it's not my job to scoop our special guest. That would be tacky and also impolite. But I would like to welcome back to CHEO. She's been here probably about a half dozen times over the last 20 months virtually, so it's great to see you here. Minister Elliott, Minister of Health, of course, Deputy Premier of the Province of Ontario. Delighted as well to be joined by the Associate Minister for Mental Health and Addictions, Michael Tibollo, and two of our local MPPs who are great champions for CHEO and the services we provide, Goldie Gamari, the MPP for Carleton, and Jeremy Roberts, of course, MPP for Ottawa West, Nepean. So without further ado, I would invite Minister Elliott to come forward and share some news.
Bonjour, good morning, everyone. It is really wonderful to be here today in Ottawa, along with Minister Tibollo and some members of our exceptional Ottawa caucus, MPP Jeremy Roberts and MPP Goldie Gamari. Thank you very much to Alex and the entire team at CHEO for welcoming us here today. I want to thank all of the outstanding staff, volunteers, and leadership team here at CHEO for your commitment to providing exceptional care to patients, particularly throughout the COVID-19 pandemic. From launching vaccine clinics for vulnerable children, to setting up assessment centers, to offering take-home testing kits for back to school, you have risen to every challenge with creativity and determination. We cannot thank you enough for going above and beyond to keep Ontarians, especially our children and youth, healthy and safe. Since day one, our government has been committed to providing modern, connected mental health and addiction services for all Ontarians. And supporting the mental health and well-being of children and youth has never been more important. The pandemic has been tough on all of us, but no more so than on our children, youth, and their families. Eating disorders are a significant issue for many families across the province. And throughout the pandemic, hospitals across Ontario have seen an increased need for specialized supports and services for children and youth. We know how hard it can be for families when their children are struggling. That is why I am very pleased to announce that as part of the 2021 Ontario Economic Outlook and Fiscal Review, Build Ontario, our government is investing $8.1 million to ensure some of our most vulnerable children and youth can immediately access the specialized eating disorder services they need at 4 hospitals across the province, including, of course, right here at CHEO. This funding will increase access to 14 additional inpatient treatment beds, as well as 10 additional day treatment spaces to help patients with eating disorders more easily transition to care in the community. As part of this investment, CHEO is receiving over $4.4 million, which will allow the hospital to increase the care they can provide in hospital, as well as provide additional services to children and youth in need of help. With this funding, we are ensuring that the world-class team at CHEO can continue to provide high-quality care so that more children, youth, and families have access to treatment and supports that address their unique challenges. Our government is firmly committed to building and making important investments such as these to build capacity and improve access to mental health and addiction services. This investment in eating disorder services is another important way we are protecting our progress and ensuring that supports are available throughout a young person's journey to wellness. So once again, thank you to CHEO for always being there for Ontario's kids. And now I would like to invite Minister Tibollo to speak to some additional exciting investments our government is making. Thank you.
Good morning, everyone, and thank you, Minister Elliott. It's great, as always, to come back to CHEO and see the wonderful work that's being done here by amazing people under the leadership of Alex here at the hospital. And I'd like to thank you and all the people at CHEO for hosting today's announcement, and again, for the great work that they do to support the mental health and well-being of children, youth, and the families. I'd also like to express my sincere gratitude to everyone across the province who works in the mental health and addiction sector for everything that you do each and every day to keep Ontarians facing mental health and addictions issues healthy. We've seen how the pandemic has had a significant impact on the mental health of young people across Ontario. After experiencing increased social isolation, the disruption of routines, and a loss of extracurricular activities over these past 20 months, young people across Ontario are feeling the impacts of the pandemic. We've seen an increase for services in the mental health area, especially supports for children and youth living with an eating disorder or suffering from a disordered eating pattern. I've met with several families across the province and have received many pieces of correspondence detailing just how many of our youth have been affected by eating disorders during the pandemic. I want to give a special shout out to two young ladies who came forward and shared their stories with me, Alyssa and Erin, and their advocacy for people with eating disorders. Thank you for reaching out. And today, this is part of why we're here, the stories that you told me that opened us to understanding just how significant a problem eating disorders are. And that's why I'm pleased to be here today to announce that we're investing more than $11 million in annual funding for eating disorder services and supports as part of our roadmap to wellness, building on the $8.1 million just announced. The funding that we're making spans services across the continuum of care. What that means is children, youth, and adults, including early intervention, specialized outpatient services, day treatment, and inpatient services across the province. And it will include $6 million in specialized community and outpatient services for people with moderate to severe needs, as well as supports for areas where there are long wait lists or no services available. And we recognize that this is in fact happening in parts of the province. $600,000 for early intervention services and $4.5 million for intensive acute care services. These investments will support individuals with complex needs and provide critical services across Ontario, including filling service gaps in Northern Ontario, while also improving additional service enhancements for health service providers to meet the needs of children, youth, and families across this province. Since 2019, our government has allocated an increase of more than $500 million of annualized funding for mental health and addiction supports through our roadmap to wellness. Through the Roadmap to Wellness, as we've seen and set a clear path for making meaningful improvements to the mental health and addictions care for all Ontarians. We're focused on ensuring that everyone has access to the highest quality mental health and addiction supports when and where they need them, because we all know and we all believe that without mental health, there is no health. Every young person struggling with a mental health or addictions challenge deserves the chance to have a good and meaningful life. And our government, under the leadership of our Premier and our Deputy Premier, will continue to work with our community partners to ensure our children and youth have access to the supports and treatments they need. Thank you, and I'd now like to pass it over to Joanne Lowe, the VP for Mental Health and Addictions here at CHEO, to say a few words. Thank you.
Good morning, and thank you so much. And I'm so pleased to be here today in person with Ministers Elliott and Tibollo, and of course our amazing local caucus members. Today, our region is really here to really thank both of you and all of you for taking the immediate action that you have to invest in increasing services for young people who are suffering with eating disorders in our area. We've all recognized that the pandemic has been very challenging for children and youth, and the impact on their mental health has been particularly difficult, as we know. Our Kids Come First health team partners here in this region have been reporting an increase in need and severity, and we have collectively monitored that, and we are working together to respond. And this new investment makes that even much more enriched, quite frankly. Today in our hospital, we're operating at a 101 capacity. That unfortunately has been our reality throughout the pandemic. And today, in fact, we have 14 eating disorders patients in our hospital as inpatients. Just to give you the math, we have 6 beds. So that means that those other young people who are not in those 6 beds that are assigned as eating disorder beds are everywhere in the hospital. And we're highly committed to really responding to their needs. And this investment will continue to make it possible for us to actually do that safely, and it'll also allow us to almost more than double our capacity to respond to their needs. In my role as co-chair of the Ontario Health Eating Disorders COVID-19 Recovery Expert Group, that's a bit of a mouthful, we heard about the unprecedented need for eating disorders across Ontario. We were very appreciative to have had the opportunity to review those needs and make recommendations accordingly directly to the government. We are incredibly thankful for both the announcement today and as well as the timeliness of the response from the provincial government. The announcement today brings these recommendations to life, and we are so very grateful to the provincial government for the $4.4 million investment that will help CHEO help those who are in need with an eating disorder. It means that we will be able to increase our inpatient services capacity and create a brand new partial hospitalization program that will help youth transition from the hospital back home. This funding announcement, as I said, will provide us with more than double the capacity to respond to those needs. And very importantly, it allows us to actually respond to the life-threatening and severe presentations that we have been seeing in the hospital over the last 20 months. And the opportunity to actually innovate and create the partial hospitalization is very exciting to all of us. The responsiveness of the provincial government comes at a very critical time for youth and families and caregivers. While today we have 14 young people in hospital suffering with an eating disorders, At CHIO, since March of 2020, we've seen a rise of 63% in our inpatient admissions. They have experienced, and that has been particularly difficult on families who have experienced their child needing to be admitted with life-threatening conditions that are arising from their eating disorder, with very low heart rates and needing to be tube fed. The timeliness of this funding, I can't emphasize enough, is so very welcome to help us respond at the right time, in the right place, with the right care. Our ultimate goal here is to continue to be there for all of these patients, to intervene earlier and be responsive and to provide excellent care. Once again, thank you for listening to the experts, the youth, and the families, and for making this happen. It is with great pleasure that I would love to and like to introduce Christopher Valle, who is here to talk about his lived experience here with us.
Well, hello everyone. First of all, I want to thank you all for being here. I'm proud to say that I have successfully won my battle against my eating disorder. I'm actually standing in front of you because of the tremendous efforts of CHIO's eating disorder program. I bravely fought for 6 years, and during that time, I experienced some highs, but more often than none, many lows. Feelings of dread and hopelessness were constant, but thankfully, CHIO's eating disorder program was here to pick me up when I was down. A reality that many youth and families are facing is the inaccessibility of treatment. We know that early intervention is key, but with the rising number of youth falling victim to eating disorders, long wait times mean that many are suffering in silence. I've been there before. It's a dark place that nobody should experience, especially youth who are still growing and maturing. That being said, it brings me a great amount of joy and warmth to my heart to hear that the province is investing in the expansion of these services. This will not only instill hope into the many who often feel hopeless, but it will allow for many to get the help that they need and deserve faster than ever. So on behalf of those struggling and on behalf of those who have struggled like myself and have crossed that road to recovery, I want to extend a big thank you and remind you that your efforts and values are extremely appreciated. Thank you.
All right. So we're going to wrap up the formal part in a moment. Before this event, Minister Elliott, Minister Tibollo, and our representatives took a moment to tour our eating disorder unit to thank the staff there. Also, some of our other units, you heard from Joanne, we're at 101% occupancy today. That's not unusual. And so when we have and we've had 2 to 4 times as many eating disorder patients at any given moment as we have room in our eating disorder unit. And so also appreciate Minister Elliott, you taking time to thank staff on other units who've also been caring for these patients. In line with what Christopher just said, when we were on the eating disorder unit, to our surprise, to my surprise, this lovely gift was presented from the patients. So this is something that the patients on the unit there right now have prepared for Minister Elliott to acknowledge this gift, and I would like to present that to you formally, Minister.
Thank you very much. This is absolutely beautiful, and it really means the world to me. Thank you.
Now take questions from media. So if you'd like to ask a question, please line up in a single file line behind the mic, and then it's 1 question, 1 follow-up.
Hi, thank you. I have a question for the minister and also for someone from CHEO. And Minister, this is unrelated to eating disorders. First off, the case count in Ontario today of COVID is over 1,000 for the first time since the end of May. Meanwhile, NACI has said anyone over 18 could get a booster. Should Ontario go further to take some steps before the new variant becomes more widespread in the province?
Well, we did anticipate when we developed the roadmap to reopen that there would be an increase in the case counts. But I think the other really important factor is that even as the cases are growing, which are primarily the Delta variant at this point, that our hospitalization rates remain low and our intensive care units remain low, where I believe we're today at 146, which is down about 10 from where we were in the last few days. So I don't think that that is anything that's unanticipated, but we are taking our approach to the booster shot very seriously. Dr. Moore did make the announcement yesterday at reducing the age rate to 50. That's certainly within the scientific evidence. We're doing it gradually. We will likely be moving down to lower ages in due course, but right now we're taking it in order of need and effectiveness. So this is why we have dropped it for the 50-year-olds and 60-year-olds who are most needing of this additional protection, but there will be lower reductions, I expect, in the future.
Okay, thank you. I have a follow-up question for someone from CHEO or who can help me with what waiting lists are like now. And it sounds like if this is doubling, this money is doubling the number of in-house beds, that wouldn't even cover the number of people, patients you have right now. Can you tell me exactly how many beds you will have, what waiting lists are like for either acute treatment or not so acute treatment?
So several parts to that question.
Yes, sorry.
So in terms of what this means for eating disorders, in particular this announcement, one of our major objectives will be to consolidate the inpatients into one unit so that we're reducing the spread across the hospital so that we're able to provide really good quality programming for young people who are in the hospital. And just by way, so we all understand, when a young person is admitted to CHEO with an eating disorder, they're considered medically fragile. So part of what we want to do with these resources is actually invest in services that will help us intervene earlier so that they may not need to be admitted to the hospital. And it's also really to help them when they're leaving the hospital. And so I mentioned earlier that we are looking to create a partial hospitalization. That is essentially the same treatment as they would get if they were in the hospital, but they don't sleep at the hospital. And our capacity currently to do that is non-existent. So this actually creates a brand new service that we can offer. In general, for mental health services and mental health and addiction services, I would say across the region, you are likely aware that we have a really great health team here in our region called Kids Come First. One of the components of Kids Come First is the mental health and addictions group, and that includes every single child and youth mental health and addictions partner or agency, families and young people. Chris is just about to join our group, and that group has done enormous work to try and manage wait times and wait lists. That said, we've seen about a 30% increase over the time that COVID has been with us. And one of the things that we also have tried to do is get kids to the right service at the right time. And so one of the initiatives that we undertook was One Call, One Click. And One Call, One Click is designed to be one point of access for anyone who's looking for child and youth mental health and addiction services. So I think that, you know, at CHEO, our wait times for mental health services, for outpatient services is typically running anywhere, again, between, 30 to 35%. What we have instituted here at CHEO, though, is a capacity to prioritize them so that if they're in the most severe need, they become a priority and they can be seen more quickly.
And by 30 to 35%, you mean higher than prior to the...
It was pre-pandemic, yeah.
Okay, thank you.
Hi there, Jeremy Sharon from CTV News. My question is for Minister Elliott, a bit of a follow-up to my colleague's first question. NACI released its new recommendation today for booster shots with the arrival of the Omicron variant, specifically that those aged 18 to 49 should be offered boosters based on individual risk and where they live. So how much does the province look at NACI's recommendations, and is that an option the province is considering to move ahead with vaccinations for certain groups, booster shots for certain groups under 50?
Well, yeah, we generally do follow NACI's recommendations. We have followed with priority for people aged 50 to 69. That is because they are more at risk than some of the younger age groups. But I do anticipate that as we work through this group and get people vaccinated with the booster shot that wish to have it, that we will then reduce the age groups as well. But we are dealing right now with making sure that we can get as many people vaccinated as possible. We still don't know much yet about the Omicron variant. We're learning more, but it will probably be at least a week before we really have significant data about the increased transmissibility of it, the virulence of it, and the effect of vaccination on people who do contract it. So much more to learn, and we will be following that very closely.
Thank you. No follow-up.
Hi, Marie-Jeanne Dubreuil for Radio Canada, CBC. The first question is for Madam Minister. We're seeing outbreaks in jails possibly linked to Omicron. What more is your government doing to protect people in jails?
Well, we are following wherever there is a breakout. We're also checking on all of the people who had traveled to those South African countries, and including increasing the list with the additional 3 countries that have been added with Malawi, Egypt, and Nigeria. So we are following up. We are doing the gene sequencing for each and every case to understand what we're dealing with, whether it is a case of Omicron or whether it's Delta or another variant. So we're following up with that. We're making sure that we do the case and contact management. We're making sure that those people remain in quarantine for the necessary period of time. And then, of course, we're increasing with our vaccinations and our booster doses. We're also working with the federal government on making sure that they have the appropriate on-arrival testing as well. And so we are working together as one coordinated group, which is what I think Canadians expect us to be doing. Thank you.
Thank you. I have a question for maybe Mrs. Klosterman. I hope I said your name right. So we often spoke of depression and anxiety when we're talking about mental health in youth since the beginning of the pandemic. Are the eating disorders been overlooked in the last 2 years, you think?
That's a difficult question to answer because what we've seen is actually an increase in need and acuity. And so we're seeing more kids come looking for help for eating disorders, and we've also seen those young people come to us in much more severe states of their illness than they might have previously prior to the pandemic. I would have to say that I don't believe at all that we've ignored them. I think that when they have come to CHEO, we have done everything in our power to actually respond to their needs, which is why when you heard me earlier talk about 14 young people here today with 6 beds. And so there are the balance of the 14 that are all over the hospital. And that has been the norm throughout the pandemic for us. And we've had an amazing team of clinicians and eating disorders leadership who have actually every single day and sometimes twice a day are huddling to try to figure out how that we can best respond to the needs of these young people.
Thank you.
And that will conclude the media portion of today's announcement. Thank you.